Good evening, everyone, and welcome to San Bernardino's Safe School for All School Health Panel. We're very excited that you've joined us here, and we look forward to a great dialogue this evening. I am your moderator, Kimberly Brown, and I work on the Safe Schools for All awareness campaign. And tonight's panel is targeted to African American and multicultural parents in the San Bernardino area. And our goal is to provide you with critical updates and information regarding your students returning safely to in person learning this upcoming school year. Before our panelists thoroughly introduce themselves, I will quickly review the agenda and general information. And after we've heard from our panelists, I'll open the floor to questions, which we hope you have plenty of because, again, this is your opportunity to get your answers regarding your students returning safely. Quick agenda, I've just welcomed you. We'll go over general instructions. I will briefly introduce the panelists and then they will have the floor to introduce themselves and provide us with some comments. And then we'll jump right into the Q&A. During the session tonight, all of your questions should be submitted via the Q&A button. You should all see that button. If you have any questions throughout the panel, please put them there. I will get to as many questions as I possibly can. I'll be reading comments too. If you just want to share a comment, those are important as well. We'll share those. The panelists will be engaging and answering some questions, so don't be surprised if you get an answer while we're going through the Q&A. If you have any questions with connectivity, I suggest that you drop the call and just simply, or drop the Zoom and try to rejoin. Tonight's speakers, I'm excited to introduce. We have Dr. Naomi Bardock, who is the Safe Schools for All team lead. She'll share a few words with you about Safe Schools for All. We have Dr. Keenan Mitchell, who is the superintendent of Adelanto Elementary School. Barbara Cole, RN, MSN, Director, Disease Control, RUHS, Public Health. Carmen Webster, Case Investigator, Contract Tracer. Deborah Williams, Director of Building Resilient Communities. Corey Jackson, Director of XBX, Youth and Family Services. And Dr. Clay, Founder and CEO of Clay Counseling. What we've done is we've tried to provide you of a panel with regional educational representation, medical experts, community educational advocates, as well as a company that services schools with counseling. So we tried to provide you with an array of panelists that can answer an array of questions for you. So with that said, I'm going to stop sharing my screen because Dr. Bardock is going to kick us off with her own presentation.
Perfect. Thank you so much, Kimberly, and thank you for organizing. We're really looking forward to talking to people today. I'm going to start out with my slideshow. Hold on. And this is our school health panel for the San Bernardino and Riverside counties. I'm Dr. Naomi Bardock. I'm the lead of the Safe Schools for All team. So I'll be telling you guys more about what that is. And we're hosting these school health panels to really help people get their questions answered, exactly what Kimberly was just saying. I'm a pediatrician at San Francisco General Hospital, which is the county hospital in San Francisco. I'm also a mom, so I bring both those perspectives, and I take care of a lot of African American, Black and Brown children, Latinx children in that clinic, and it's part of what really motivated me to do this work, to really support everybody to have a safe but also in-person instruction, to really help people get back to that learning. And then there's one other hat I wear, which is that I'm a health policy researcher. Like I do research, I think about what is the information we have. And so one of the most important parts of the job that I have is making sure that I really look at all the information that comes in. I don't have an idea first of what answer I want. I just make sure that we're looking at all the best information to help understand how to make the right decisions for our kids and for our schools in the COVID-19 situation that we're in. So a little bit about the Safe Schools for All initiative. It started actually in December 2020. The focus was to really pull together a lot of resources in the state of California to support a couple different very specific things. The Safe Schools framework includes funding, dollars to help support safe schools, because we know it's complicated. You can't just use your normal school budget to do this, right? But we also know dollars aren't enough. Hands-on assistance, technical assistance, information about how to do it, how to support schools is also an important piece of what we do. And then safety measures, really tangible things, physical things, masks for schools, and also testing supplies and testing information. And then finally, transparency and accountability to try and help understand what is going on in the schools environment, what kind of cases are going on. There's a website that we've provided that really helps to actually show some of that. And so I'll show the link to that at the end of the slide deck. Throughout all those different 4 layers, equity is a really important piece. It's the perspective I bring as a pediatrician on the ground. It's also a perspective that is really important. The state believes strongly in saying we got to do things equitably. We got to help lift up particularly communities that have already been disproportionately impacted by the pandemic as we think about schools. And then finally, we bring together both state level, but also local. We know that the local efforts are so important and it's so key, and it's why we're doing these school health panels in a more local way. We're not just trying to do a big statewide thing, because we know different context is different, and it's important for people to hear from the people they trust and know. So a couple other things, those funding dollars for school safety and for kids, we have over $25 billion actually from the state and from the federal government, the national government, to support safe schools in California alone. And that goes to masking, it goes to ventilation. We'll talk a little bit more about these layers in a minute. COVID-19 testing, cleaning, extra instructions, so not just the public health stuff at the top of the list, but also all those things that we know to support kids through the pandemic, extra instruction, making up for learning loss, social and emotional and mental health services, really important pieces. All those dollars can support those things. And then also a strong safe schools network of the county education and health departments, bringing together at the local level, at the county level, those partners so that education and public health can be talking to each other. So we've learned a lot since the beginning of the pandemic, since March 2020. And what do we know? Research shows, the bottom line is that shows that schools can reopen safely and stay open. We learned some surprising things. One big question, we thought that the kids would actually spread COVID-19 just like they do. You guys know, viruses, coughs and colds, they pass it around, they get those things. Parents know it better than anybody else. And it was really a big question in the beginning of the pandemic. And it's part of the reason that all the schools shut down. But it turns out that kids do not get COVID-19 as often as adults do, and they do not get as sick. And that's still true in the Delta variant. I'll talk about Delta in a couple minutes, but that's true even now, actually, with the Delta. They just don't get it as often, and they don't get as sick. Why do children get COVID-19 less often and are less sick? And this is a piece of science that I think is helpful. I've heard many parents really appreciate to understand a little bit, because it's kind of a head scratcher, right? It's not what we're used to. The take-home point from this study from July of last year, ACE2 receptors are the entryway for SARS-CoV-2, the virus that causes COVID-19. You don't have to remember ACE2 receptors, just remember they're the doorway into our bodies, into our cells for the virus. And the ability to make those doorways varies with age. It's different depending on how old you are. With elementary students, make less of those ACE2 receptors compared to middle and high school students who make less of them than adults. And so the implications, the take-home point is that if you have fewer doorways into the body, that's why they get less disease and have more mild disease. We also learned that most school-age children get COVID from a household adult, and that's true. It's been across the world: Greece, Australia, China, Switzerland, Chicago. And it actually kind of makes intuitive sense when we think about it for a second. We have a lot of close contact in our household with our family members. Our masks are off, we're eating together, much more so than in schools. Schools are really good at creating structured environments where people are able to keep their masks on, do things as a group, be really routine. And the implications for that is that vaccinations for adults, at-home adults for kids, at-home adults for teachers, also teachers and school staff, is really key to preventing infections in kids, and it provides a wraparound layer of protection for kids. And then finally, the third really important piece is that studies also from around the world, the US, California included, showed that schools can operate safely when there's safety measures in place. They call it the Swiss cheese model. If you have all these layers and the holes don't line up, you've twisted around the holes, you block that virus from coming through. And so you can prevent viruses from passing in the school environment. And that's actually what we do in schools. That's how we're keeping schools safe. So I want to talk a little bit about the upcoming school year. The sort of overall goal is that it should be safe and full in-person learning. We want to support education, mental, emotional, and social development of kids. So we just recently published our school's guidance from the California Department of Public Health. It's available online, but I'm going to go through one by one. What are those layers that are in place? First of all, vaccines. Vaccines are just a major game changer. They've been found to be safe and effective. Over 7 million doses have been given to children in the United States, and they've been shown, for ages 12 and older, they've been shown to be safe and effective in that group. And we know that the vaccines are actually the way out of the pandemic. So that's why so many people are talking about vaccines. The more people are vaccinated, the less the virus can spread, and the less they can get unvaccinated people sick, including the kids. Also, masks. There's a universal mask requirement. Indoors, it's required. Outdoors, it's optional. But the thing about the virus is that the virus is airborne. So we know that masks are one of the most effective and simplest layers that we have to prevent the spread of virus in schools. And they've shown to be really effective, both in schools, outside of schools, super effective, really an important layer. Ventilation. Basically, that means that do you have airflow in your classrooms? And the guidance says airflow should be optimized. We know that it helps to move clean air in and makes the indoors more like the outdoors. Outdoors is safer. It's the virus disperses. It goes away much more easily in the outdoors, and that's what happens with the ventilation. It moves things around and out of the room. Hand washing, always a good thing to do. Particularly with COVID, it helps to prevent infections from spreading, but it's one of those additional layers that we have. Staying home when sick. We know that people have COVID symptoms sometimes, not always, but oftentimes they do. And so staying home when sick and getting tested is actually a great way to prevent passing whatever's making you sick along to somebody else. And it's really important we're all in this together. And so staying home when sick, it keeps you, gets you healthier because you're staying home, and it helps other people stay healthy as well. COVID testing can detect the virus for those people who don't have symptoms yet. It detects the virus, it detects COVID-19 before a student or a teacher starts to feel sick. And schools can do regular testing with their unvaccinated students and teacher to help keep the school safe and everybody staying in school. And California actually has $1 billion in resources for testing, which means that we can do free testing. We can offer free testing from the state through the schools to all the students and the staff. It's one of the actually most robust programs in the nation. They call it, best in class. Many other states don't have it. We're extraordinarily grateful and lucky that we have it, and so we can use it as an additional state safety layer. And then transparency. Transparency means that your school should have good information easily available about what their safety plan is. It empowers you to understand what's going on, and it's something that's included in our guidance. We say it's really great. Post your safety plan. It's required actually by some people who are getting federal dollars are required to post a safety plan, but you guys should parents should feel free to be able to ask for it and understand what the safety plan is for their schools. I want to talk about the Delta variant for a minute because we know that it's worrisome, but we have some key tools that still keep the school safe. Why is it worrisome? It's worrisome because it's more contagious, meaning it's easier to pass from one person to the other. But it's important to know that in California and across the nation and other places that are having Delta surges, because it's sort of all over the place right now, the hospitalized patients are adults and mostly unvaccinated adults. So as we think about what can we do, what are the tools we have, vaccines are very effective. They slow the spread. It's really important to be fully vaccinated for Delta. It's been shown that 1 dose isn't quite enough. 2 doses is key. If you know anybody who's only gotten 1 dose, encourage them to get that 2nd dose. And then keep wearing those masks. Masks are still very effective with Delta. So here's the picture of the key layers we have for schools, highlighting vaccines, 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 really helpful. It creates this wraparound protective layer around schools, masks, ventilation, testing, and stay home when sick. And I just want to end by pointing out that there's a really terrific resource that the schools team has been working on. It's the Schools Hub and Parent page. It's been up since early January when they sort of published it, but it has some great information on the schools parent page, which you can see on the right-hand side of the screen here. It's both in English and in Spanish. And then the website is down here at the bottom, schools.covid19.ca.gov. And that's it. Thank you guys so much. I'm looking forward to the question and answer and hearing from all of our other fantastic panelists. Thank you.
Thank you, Dr. Bardock. Next, we'll hear from Dr. Keenan Mitchell.
Hi, good evening, everyone. Thank you for having me. I appreciate the time this morning, tonight. My name is Keenan Mitchell. I'm the superintendent of the Adelanto Elementary School District. Adelanto Elementary School District is in the high desert. We serve 8,000 students in grades K through 8 in the cities of Victorville and Adelanto. Our students will be starting full-time in-person instruction next Monday on August 9th. In terms of our procedures and COVID protocols, we will be requiring masks indoors and outdoors. We will have desk shields for staff and students. We will require self-screening at home and temperature checks upon arrival at school. We will not require social distancing, and we will use frequent COVID testing to keep schools open. Since March of 2020, we have spent more than $15 million on PPE supplies, face masks, sanitizers, those kinds of things, air purifiers for all classrooms and office areas, filters for our HVAC systems, touchless paper towel systems, and water bottle fillers, walk-through temperature check kiosks, as well as Chromebooks, laptops, hotspots for all students and staff as necessary. So we're looking forward to a healthy return to in-person instruction. We anticipate many challenges, children keeping their masks on their face. We see a split in our community, almost 50-50. We have about 50% of our community is against masking, and about 50% of our community want us to require. And so this issue is kind of split both our staff and community. But as educators, our priority is to get kids in front of teachers. We realize that the distance learning model was necessary, but is insufficient to meet the learning needs of our students. And so we're hopeful that we will be able to return to school and remain in school and get back to learning. Our community has suffered greatly through this pandemic. The Adelanto area had the highest COVID cases in the high desert. Many of our kids experienced multiple deaths of family members, and so this community has been hit especially hard. I don't believe that more than 35% of our community has been vaccinated. I think there's still a lot of fear and trepidation about the vaccines for our families here, which is a working class community and had to be out and about during the pandemic in service jobs, and had a greater exposure to COVID and caused increased cases. And so throughout most of the pandemic, the Adelanto community was more than double the county rate of positive cases. And so we're concerned about the low vaccination rate, and we are prioritizing trying to get back into in-person school. But given that, we also realize that our kids are coming in with many mental health issues and as well as significant achievement gaps in their learning. And so our hope is we provided a full summer school this past summer. About 500 kids attended, but even with that, I had to quarantine about 200 kids in and out of the school, so that was challenging. And so we're hopeful that us contracting with a company to help us do some testing right away will mitigate the needs of quarantine, because really we were quarantining kids with symptoms, but weren't really sure if kids or staff had COVID. And so we're hopeful that a company to help us do some rapid testing to get us some definitive answers about a person's COVID status before we quarantine will be helpful to mitigate these issues. And so as an educator, I've tried to stay away from the science debate. I've instructed our families and board that I am an expert in the science of teaching and learning, and I will leave the science of the COVID and the vaccination and all the debate to our scientists and our healthcare professionals. My interest is getting kids in front of teachers. Thank you.
Thank you, Doctor. Next, we're going to have Barbara Cole. Barbara?
Good evening. All right. So I'm off of mute. Can you see me?
We can see you and hear you.
All right. Well, thank you for the opportunity to share some thoughts and information. So I am a public health nurse with Riverside County Department of Public Health. I have been doing public health for over 40 years. The thing I love about public health is that it presents us with an opportunity not only to look at individuals, but to look at our community, our population, as quote, our patient. So many of the public health interventions are geared towards the population in addition to individuals. I think immunizations is a true public health success story in many instances. I think depending on people's ages, some of you will remember when there was polio and lots of people were ill from it. It got eradicated because of vaccinations. We've had measles in the last 10 years, multiple outbreaks, but vaccination is key to protecting individuals. So same story, hopefully, with COVID vaccinations, very effective, safe vaccines. I think our challenge at the moment is that we are seeing now the variants, and that was shared about what makes the variants more of a challenge. So we know the variant COVID can be, some of them can be more contagious, more easily spread. And you'll see from CDC, it even says more contagious than chickenpox. And the reason that's significant, you can walk into a room with someone who's had chickenpox, and it can be 2 hours later. And if you have not had chickenpox, very easy for you to get infected. So we get questions about, with the variants, do the vaccines still protect? It is felt the vaccines still are effective with variant COVID. People tend to be less sick if they've been vaccinated. People tend not to end up in the hospital. And hopefully there aren't fatal cases. So we think it's so important to share this message of, if people have not been vaccinated, for us as healthcare workers, public health officials, educators, to help people understand why vaccine is so important, address their concerns, and hopefully assist people to make an informed decision about getting vaccinated. I think as parents, all of us think about our children and how we want to protect them. We think about, if we're older, we think about our grandchildren and how we want to protect them. So vaccination is key. We do have the other strategies, the different layers were mentioned. So from a public health perspective, obviously we think vaccination is crucial, but we're also looking at the other protective measures. Hand washing prevents a lot of diseases from being spread from one person to another. We know that wearing appropriate masks and wearing them appropriately fitted makes a difference in how much droplet gets into the air and potentially can be spread to others. And we know that even though people are fully vaccinated, sometimes indeed they can still have what's called post-vaccination case. And so we're looking at all that, we're tracking that, but we also know even if someone tests positive that's been vaccinated, that they will tend to be less sick and most of the time do not end up in the hospital. So again, the point to stress is, yes, there's some challenges with variant COVID, but we know vaccines are effective. From a public health perspective, we also look at when people are infectious, making sure that they're in isolation at home so they don't spread the virus to others. There's also review of individuals who have been exposed, and I'm going to defer more comment on that to Carmen, who will be talking about it shortly. I'd like to just share that I have lots of family members who were hesitant to get vaccinated. And their question to me, since I'm a nurse, was, would you get it? What would be the concern? And so for me, I felt it was important for me to show them why I felt it was safe to get it, why I got vaccinated. And ultimately, all of my household was vaccinated. So I think we each play such an important role by leading by example, answering questions in a non-judgmental manner, and hopefully people get to the point they can make their own decision about getting vaccinated with these very efficacious and safe vaccines. Thank you.
Thank you, Barbara. And you did a good job of turning it over to Carmen. Carmen?
Okay, thank you. Helps if I unmute. So good evening. My name is Carmen Webster. I work the County of Riverside Department of Public Health, and I work specifically with the schools team. And the schools team are public health contact tracers and investigators that have been specifically designated to work with schools and school liaisons and to answer questions that come in from schools. So just to let you know a little bit about me, I've worked with public health for about 12 years. And when I don't know something, I go to Barbara Cole. So our schools team, I also want to say that I am a mother and I am a grandmother. So I understand concerns about children going back to school. But I also know that keeping them home is not the best option because it's another risk of them falling behind with their learning and for poor outcomes. So I'm so glad that Dr. Bardak addressed all of those scientific concerns. In public health on the schools team, we work with the schools. So our job is to contain if there is an exposure or an outbreak or a case that happens in a school, is to contain it, to make sure that that person that is sick stays home and isolates, and anyone that's been exposed to them is quarantined, and that way we can expose it, we can contain it, we can contain it and make sure that not everybody in the classroom gets sick or everybody in the school gets sick. So as soon as we're notified, we enter them in and we call everybody that's on the exposure list who might have been exposed. That way we contain it and we keep everyone from getting sick. And that's basically what we do. We do that by answering phone calls, and we take that information by email and we enter into SPOT, which is the school portal for outbreak tracking, and we track it that way. And that way we can, we've even had at times a whole classroom to shut down because there was an exposure in order to contain it. Not that they needed to shut down the whole classroom, but that was their effort to contain it. And that's what schools have done to keep it from spreading and keep it from transmitting. But we're also thankful that we know that kids don't transmit, and thank Dr. Badak again for sharing that. Kids don't transmit and share COVID as well as adults do. And so that's reassuring to us. And we're here to serve and to make sure that we help contain it when we're notified. That's what we do.
Thank you, Carmen. I appreciate that explanation because honestly, I did not know what a contract tracer did. So thank you. And I'm sure a lot of other people didn't know. We're going to move on to Deborah Williams.
Good evening. Thank you for inviting me to participate. I'm happy to be here. My name is Deborah Williams, and I'm the founder and CEO of Building Resilient Communities. We are located in the city of Redlands, but probably like a lot of you, we've been working virtual since last year. We do three primary things. We are a nonprofit, a community-based organization, and we work across all of the Inland Empire. But we also work from the local level all the way to the federal level of government. And so when we have blue skies, what we consider blue skies or no disasters, then we are out working with the houses of worship, community-based organizations, with youth groups and with families to help them prepare for any type of disaster. We are so focused on COVID, but I just have to remind you all that we could have an earthquake at any time. And we are in wildfire season year round now here in California. And so our role is to make sure that we don't lose sight that other types of disasters are still occurring, even though, it feels like, working with one hand and the other one tied behind your back because we have COVID happening at the same time. So that's our primary role. When disaster does strike, then we go out and we help in communities with the response. So during COVID, really since last May, we have been doing several different things, but one primary project that we have is what we call Mask Up. And so we are able to get masks out through what we
Is Dr. Cole frozen or is that my screen?
I think it's frozen. It may be internet connection, maybe.
Okay, we're going to pick back up when she's able to rejoin us again. We're going to move on to Corey Jackson. Corey?
Thank you
Hi.
very much. Really appreciate the invitation to being here. I'm Corey Jackson. I serve as CEO of SBX Youth and Family Services, providing youth development and community development services throughout the Inland Empire. I also have the privilege of serving on the Riverside County Board of Education as well. I would just offer two things for us to think about. Number one, as adults, our most sacred responsibility is to ensure that the next generation is better off than we are, to make sure that they're healthy, to make sure that they are prepared for when it's time for them to step in to the role, to then pass on to the next generation that they have. And to do that, though, we have to make sure that we understand that also the biggest impediment to making sure that young people have what they need are adult issues. It's the adults who are messing things up to make sure that they have what they need to be healthy and to have a strong foundation within our communities. And so the best thing that we can do is get out the way and let the education professionals do what they do best. And that is keep our young people safe and to get them educated. Our young people are experiencing so many adversities at this time that is so overwhelming that anxiety rates are high, depression rates are high, suicide rates are high. isolation is high, and unfortunately, the learning gap is high. So we have got to do everything we can to make this work. Everyone has said their piece on what they think should or should not be done. You said your piece, now let people do what they need to do so that we can make sure that our young people as a whole, because it's not, your child is not just your child, it's all of our children. We all have a responsibility to make sure that they're provided with what they need. Elections come and go, opinions come and go, but the science stays the same. And that is, we don't know exactly where the science will always lead us, but we do know that the science has done everything they can to make sure that they give the best information possible. And the best information possible is that we need to be vaccinated, we need to wear masks, and our children need to go back to school. We've got to make this work. If we don't make this work, us as adults have to bear the responsibility for that. And so we urge everybody to do their part. And sometimes doing your part means just be quiet so that we can make sure that our children get what they need. Thank you very much.
Thank you. And we're going to close out this portion of the program with Dr. Clay.
I loved all that. Telling grown folks to be quiet, Corey, how dare you? I loved it. So good evening. My name is April Clay. I am the CEO and founder of Clay Counseling Solutions. I also am the executive director of Clay Counseling Foundation, our nonprofit organization. I'll tell you what, I'll just make it really brief and tell you a little bit about our foundation. So Clay Counseling Solutions itself is a mental health organization providing services to the community. We love to support and provide resources to schools, specifically kids K-12, as well as adults and families. And then our foundation, on the other hand, is centered around providing resources, providing large activities. So we like to do synergy events with kids. We like to do work with providing resources to educate educators on anti-racism was the new word, right? Before anti-racism was taboo, but now we like to use it. So let's go ahead and use it. So absolutely engaging in anti-racist work, but that's been since our inception. We've been doing this work for a long time, and we make no apologies for that work that we've been doing. We just colored it differently. We just called it cultural responsiveness because we use that terminology as well. But at the end of the day, the crux of our agency is centered around bringing out the best in our schools and our families that we serve. And the best way you can do that is to educate the community. So restorative practices is one of our primary features. And the list goes on and on. Just love the work that we do for the community. But when it comes down to it, my primary hat that I wear is a servant leader. I am a licensed marriage and family therapist. I am a mother, a grandmother. I have a lot of roles that I play that don't pay me, and they pay me the biggest, right? The biggest return. So if I were talking to you as a parent, and I believe that most of us get into the work that we do because we care about other people. That's the reason why we do this, because you'll never get to be the richest person in the world serving folks in the capacity of nonprofits, serving folks in human services, serving folks in education. It's just not the road to financial, extreme lavish living necessarily. Some folks pull it off, but that's not what brings us to this business. What really brings us to this business is the compassion that we have for others. And that being said, I have to put my mental health hat on and tell you some things that I'm concerned about when it comes to sending our kids to school versus not sending our kids to school. And I do believe that shamelessly, Corey told you what you needed to hear. We all need to be reminded that educators are professionals. You can trust a doctor with the tools that he is given and the education he has. Why wouldn't we also trust our educators with the tools that they're given and the education that they have? In addition to that, why wouldn't we also trust educational leaders to take us down the right path to safety? If you notice, San Bernardino County, specifically San Bernardino City Unified, and some of our neighboring schools shut it down. They were like, close the doors, send all the babies home. We don't care what you offer. We're going to make sure we're safe first. So recognizing that our community, San Bernardino and Riverside counties alike, did put safety as the highest priority when it came to our children. Remember that. Let's start there. So we cannot think that the same people who closed the doors early on before it was required would also then turn around and open them without being concerned about the safety of not only themselves, but also the children that they're serving. So remember that first. And then in addition to that, I want you to know some very important features of being at home and what that means to our children. So when we leave our kids at home, we leave them to their own devices. A lot of times we think that as adults, we're all over it. We're like sophisticated. Let me tell you, my 4-year-old grandson can outdo me on my iPhone if I give him enough minutes. He will lock that sucker down. I'll be like, what did he do? They are very good with technology. They can create ghost accounts. They can do all kinds of stuff to make sure that their fun is separate from us and our viewing. We need to be able to have better eyes on our children. They need to be supervised 24/7, right? How can we do that and be at work at the same time? Let them go to the educators who are trained to deal with them. Why not? Right? They're back in safety. And we know the CDC, the California Department of Public Health, all of these agencies have lined themselves up to be able to make safety a priority. Let's give them back to the educators so that they can educate our children. That's step one. The second thing I want you to consider is that when we're bringing kids back safely, the time that they were missing with their family and friends because the world is opening back up again will be recaptured. They'll be able to start to see people again. I know that you love them. I love my children. I love my grandkids too. However, they need time with each other. They really do. They've been going through some emotional stuff, and I don't let my kids vent about me. Let's be very transparent. Neither do most of you. We don't let our kids talk about us to each other, to us, right? They need to have peers. They need to have somewhere to get this out. And what I'm saying is, it's therapeutic to be with your peers. They need to be able to say, my mother, she is all in my business. Or my mother, she's all in my business. However they experience us, they need to be able to share that with their counterparts. In addition, I want you to know that because they've lost loved ones, they need to be able to process the grief they're experiencing. And if you think sitting on the couch with you is a good therapeutic tool, I promise you, there are better resources than just you. You can definitely benefit from talking to your kids. It's super important, but they need to have peers to process the life experience they're having. They also need to have teachers that check on them, right? That notice the changes in their personality so they can reach back out to you and say, Mom, you know, I noticed that to this week, your son was doing this. You need that other set of eyes to check on your kid. It's a part of growing healthy, well-rounded children. I want you to know that this is all a good natural thing that we need to get back to so our kids can be healthy and emotionally balanced. And in addition to that, I want you to consider the Zoom fatigue you're having, our children are having also. If you, like me, have had to work remotely, you, like I, might be a little bit burnt out. Our meetings are back to back. It seems to be endless. Our kids are experiencing very similarly. Think about that. And the break you'll get from having them gone to school, you can benefit and they can benefit too, because they need that break from us as well. And then the next thing I want you to know is engaging in significant life events will increase in a healthy, safe way when they're practicing doing this in safe, healthy environments with their peers. So if you take them now from being at home with you 100% out to hang out with their cousins, guess the first thing they're going to do? Mask off. But if they're at school and they're practicing how to socialize, continuing to wear their mask, how to wash their hands religiously, you know, just get engaged in some of these healthy, safe practices of being in peer environments. When they go to spend time with their relatives and loved ones, they'll be well trained up and be able to continue to practice in healthy interactions with their peers and their counterparts. Very, very valuable lessons they're going to get from being able to be back in school. And then I want you to know, this will give us a chance to counteract some of the lack of or loss of security and safety that our kids have experienced. So when you think about grief and loss, one of the best ways children work through loss is by going through routines. So when a child loses a loved one, you want to give them a little time to mourn, but then you need to get them back into their routines so they can begin to process and get back to quote unquote life as normal or life as they knew it before that significant loss. Well, they haven't had a chance to get back to normal yet. So they're continuing to stress and worry about the next loss of life. They're worried with you. They're worried as you are worried. Also, giving them a chance to go back to school gives them something else on their mind to look forward to. And then I won't leave you with that. I'm going to leave you with a couple tips. Here are some tips that you can use to engage in preparing them to go back. consider you have the ability to communicate with them every single day and normalize some of the adjustments that they're having to go through. You want to be that listening ear so you can tell them, man, I know Miss So-and-so is not that best right now, but remember last year or 2 years ago when you had that new teacher at the start of the year, how was it? And then process, well, remember at the end of the year, you were kind of sad you weren't going to be with that teacher anymore. This will be very similar. Let's just give Mr. So-and-so or Miss So-and-so a chance. Let's give that teacher a chance. You're going to help them normalize some of the things that they haven't had to deal with, like people, like asking questions in person, like social awkwardness, like isolation or having to sit alone, making that first conversation happen. I want to encourage you to open up the door to conversations like that, to normalize some of the things that they may not have forgotten that they were going to have to get used to again. I also want to encourage you to develop some fun routines that they can look forward to, like end of the week, every Friday we do this, every Saturday we do that, so they can get excited about working through their week to get to the end of the time that they can spend with you, right? The end of the week, and so they can spend that time with you. Acknowledge some of the changes. I want to encourage you to have open discussions, process their grief with them. Of course, if they need help, I really recommend that you give them access to help. One natural access they have is the school counselor. Why not normalize talking to the school counselor? If that's what they needed someone to talk to, they do have educators and professionals on their campus that they could talk to when the time comes. Those would be my tips, but I'm also going to stay with you. Thank you again for setting this up and for allowing me to participate in the dialogue.
Thank you, Dr. Clay. We're going to jump right into the Q&A. We have quite a few questions. But before I just want to make sure that I was clear that this panel is for the Inland Empire, San Bernardino, Riverside. This is for all areas. This is just not San Bernardino. So I'm going to jump right in. And I think this is probably for school, for the education experts, as well as Dr. Bardock. If a student gets sick, do they need to take a COVID test in order to return to school?
I think the fastest way to get them back into the educational environment is to take a test. And so most districts in the state of California are contracting with companies that will provide services to test kids right away. I think the mistake that we made in Adelanto during the summer school session was not having a company to do that. And so we went the safest thing possible was to then, hey, we heard about kid had symptoms, and so we quarantined a lot of kids and we sent a lot of kids home. And I think in hindsight, and of course hindsight is 2020, I think we would have been able to make better decisions had we had clear information about you're either COVID positive or you're COVID negative, and so there is no in between. And so getting that information fast will prevent us from quarantining kids inappropriately. So I think that if a student is exhibiting COVID symptoms or has had contact with a COVID positive patient, I think getting them a test fast as possible is the best course of action to keep schools open.
Thank you. I think this is a basic question that a lot of parents want to know. Are masks mandatory in schools?
I'll answer that one, but then if somebody else wants to follow up with it, I see Dr. Mitchell came off mute also, but masks are mandatory indoors in schools for students, for staff, and for teachers, and for any adult actually walking through the school at any time if they're in an indoor space with other students. For outdoors, masks are optional. Some schools are still choosing to use masks outdoors as well, and to make them required outdoors. So that's up to the school.
Thank you. There's an interesting question I'm going to try to dive into, and I'm not sure how you want to approach this, Dr. Bardock. It says, given the fact that the CDC's latest mask study was rejected by peer review, please present the exact peer-reviewed study that you are relying on when invoking mask rules.
There's actually multiple different mask studies around from around the world, actually, not just nationally, but also internationally. The CDC actually has a very long science review that actually emphasizes or sort of summarizes all of studies that support the use of masks. And the thing, I'll cite a couple of them, the studies that are all sort of tell the stories of some of the studies, just try to do it briefly. There is an early study of hairdressers indoors who are symptomatic and had COVID. They had their mask on. They cut hair for multiple different people in the hairdresser salon who are also masked, and nobody got sick. That was an early on study. They also found that in a boat, right, which is a very tight quarters, they found out there was a COVID infection on that boat, and they were able to airdrop, this is a crazy story, they were able to airdrop masks into the boat, and it decreased the risk of infection by 70%. And, you know, that's, do we know how people were wearing their masks? We don't know, but it was extraordinarily effective compared to not wearing masks. And we know from the science that it's an airborne disease. So that's why wearing the mask, it stops the virus from coming out directly from your mouth and going to other people. So that's the sort of evidence that we use. It's multiple different studies supported by the CDC, and the evidence continues to accumulate how important they are. And I'll say one last thing, which is we've also seen situations where masks are not on, and that is a situation where we've seen transmission. There's an early study from Israel, in a school in Israel, where they didn't have the masks on because it was a heat wave and the air conditioning was on, there was no ventilation, and that actually led to an outbreak. So we know that those pieces are really important, those layers are important, good ventilation and good masking.
Thank you. We have a comment that says, I have read the newest research indicate that the Delta variant, even though not as deadly in kids as in older subjects, show an increasing amount of long haulers. You know, if Barbara or Carmen might want to take that question.
I don't think at this point we've seen a lot of data that tells us about the impact of the variant on the long hauler syndrome. We certainly are following up with our cases that were diagnosed with COVID to see how they're doing, what kind of symptoms they're still experiencing. But I have not seen a specific study that says having a variant increases the long hauler syndrome or problems. Certainly we know the variant can result in people being sicker, but we're seeing that often early in their infection versus several months later when they would normally be recovering and now they're still ill. So I think the science is still needs to be more concrete about long hauler syndrome and variant.
Thank you.
Yeah, and I would agree, I would second that. That's what I've also understood from reading the literature, the science, yeah.
Perfect. Piggybacking off of an earlier question when they asked if masks are going to be mandatory, we have a question that says, will a mask be forced on special need children? Her child or their child has a sensory disorder, and wearing a mask for over an hour, they want to pull it off.
There is an exemption for children with special needs if they have a medical reason or a reason such as stated in that question. They can get an exemption and not have to wear the mask for those special circumstances. It should come from their medical clinician or professional.
Perfect. Interesting question. If a virus is airborne, why not make masks mandatory while students are outside as well as inside?
I think Dr. Bardock answered that perfectly in her presentation when she talked about ventilation and how it's not the virus just it disperses when it's outdoors is what she shared with us. So outdoors ventilation is so important to bring the air inside, but outdoors the virus is not as effective at transmitting and spreading. So that's why it's not required outside.
Understood. How will we meet ventilation requirements when it is cold outside or weather conditions make students or force students to be inside? Does anyone want to take that question?
I was going to try and take it, but could you read it one more time? Because I was
Sure.
yeah.
How will schools meet ventilation requirements when conditions outside force the students to stay inside?
So the ventilation outdoors is a good source of ventilation, and then indoors, so many schools have been working on their ventilation to make that airflow move outside of the class, you know, the air that's in the classroom. It's called air exchanges. So you can use a couple different things. There's HVAC systems, which means the inside structures in the school that circulates the air. You can also use filtration devices. And I believe Dr. Mitchell mentioned some of the things that they're doing on ventilation is actually that type of thing. And you can speak up also and correct me if I'm wrong, I apologize, but there's filtration devices that can actually clean the air. And then also you can, if the outdoor conditions allow it, you can also open one window and open one door. They've found that at least 2 points of ventilation is actually, that's the helpful thing that gets things moving. The things that you don't want to do is close everything up, and like in that case in Israel was close everything up and then they turn on their air conditioning. The air conditioning was just moving things across the room. So that was not a good way of doing it. But when you get that air exchange and that air flowing, that actually can be a really good way of doing it. Even when you're indoors, it makes it a safe environment.
Great. Will transparency include informing parents of the percentage of staff at their schools who aren't vaccinated?
That piece might be helpful for a school leadership to talk about how you think about that. It's not a requirement in the guidance. The guidance just basically says you should say what your safety plan is, and it doesn't say specifically you have to say, you know, what the metrics are of how much vaccination is happening, et cetera. I know some schools, there's a lot of people talking about, you know, how are we going to understand vaccination and all that, but there's no like state requirement saying that has to be a reported number.
Let me add that with one of the other panels that we did, there was a counselor on who was very passionate about empowering parents to really be in touch with their schools and to really ask these questions to their administrators, because again, you know, there's a plan for students to return safely, but there's also a responsibility of the parent to make sure if you feel like there's an answer that you're not getting or that someone is not able to provide, you have a remedy. You can go to your administrators, you can go to your school, you can demand, I hate to use the word demand, but you can demand those answers and you can establish that relationship that opens up the door for those type of answers. So I encourage parents to be empowered. If you feel like your answer is not being addressed, or if you feel like there is not transparency, you have a voice. And so I would just encourage parents to do that. Here's a question about the second dose. How important is it to get the second dose on time for kids 12 and older?
It's great to get it on time. Much better to get it on time than to get it early. If you can't get it on time, still get it. Just get it when you can get it. You know, if you're a day late, like, no, don't stress about that, right? Like, just get the dose, it's great. And you know, the reason to get it in the interval, and the sort of on time interval, is because it just decreases the amount of time that they're unprotected or less protected. So 1 dose is good, 2 doses better. The closer you can get that second dose, the more protection you get. But if you haven't gotten it and you're late, quote unquote, just go ahead and get it. Don't worry about that piece of it. And then I think I saw Dr. Cole, Barbara Cole's hand up maybe before, if you wanted to add something else to that.
I was just going to comment that obviously all the studies were based on specific time intervals, depending on which vaccine that's given. So ideally, you want to adhere to those because the thought is you get better protection, but it's better to be delayed in getting it than not to get the second dose. So with that second dose, and we're talking about Pfizer and Moderna, those 2 vaccines, it's found they're 94 to 95% effective, meaning people develop immunity. The one vaccine, J&J, where there's only 1 dose, is also good, But the thought is with those first two, you're going to see a high percent of protection. So we encourage it, but I would agree if you're delayed, please still get it because it still will afford increased protection when you get two of those shots for those vaccines that require 2 doses. Thank you.
Thank you. Someone said in LA County, they know that all staff and students are tested weekly. They want to know if this is something that hurt this county, San Bernardino, Riverside, Inland Empire, if that's something that they're going to be doing as well. Maybe Dr. Mitchell, you can talk about what your school is doing. I think he's on mute.
Yes, so we will be testing kids that have either had close contact with a COVID positive case or exhibiting symptoms either at school or before coming to school. We have not looked specifically at mandatory testing, weekly testing for students at this time.
Okay. This question is for you, Dr. Bardock. Who decides how the funds are distributed to the schools for COVID testing? Parenthesis, how the test will be used and in what circumstances?
Great question. The funding came to the state and is state dollars, and it supports testing programs. Generally speaking, the way these dollars work is it supports testing programs that the state is, saying to people, there's free testing available. It's different kinds of tests, one called a PCR, one called an antigen. Schools can come to the state and say, we'd like to do some testing at our site, and there's ways of bringing those schools on board. And the resources are not just like test kits, but it's also software to help support families to be able to fill out a consent form saying that it's okay for their kid to do the test, because the parents always get to say yes or no about doing testing. So there's software. The software actually helps to get the information back to the schools and back to the parents about what the result is. And then also a lot of training to help support those schools. So the funding doesn't go direct to the schools because all that's kind of technical, and a lot of schools are not used to doing that public health stuff. So all of those dollars are supporting a structure that then schools can tap into, basically be like, hey, I really want to do the testing. And I think Dr. Mitchell, their school probably has been doing it either with us or with another vendor. There's a lot of different ways of getting the testing out.
Perfect. We have a comment, and it says, I am a family medicine physician in LA, resident of Jurupa Valley, and want to ensure all kids return back safely to schools. Jurupa Valley isn't doing as well getting vaccinated, and so she wants to thank us for having this panel. We thank you for your comment, Veronica. Several questions are around this area, so let's ask this question and put it out there. How bad does COVID-19 have to get before schools shut down again?
Corey, that was a good reaction. You're like, that's an important question here. Maybe I'll start with that because that's a kind of public health decision and thinking. The reason schools shut down in the first place was what I was talking about in that very early slide, which is kind of goofy with the kid picking his nose because I'm a pediatrician. I apologize. But it was because there's a real fear that schools were going to be a place where the virus was going to spread and things were going to contribute to kids getting sick and community transmission. And we found that with COVID-19, that's just not, it doesn't work the same way that the other viruses do. So, and we know that these safety layers are really effective. So I would anticipate that a whole school shutting down would not be something that would be happening. Like we don't see that as happening. We don't see it in other places that have had the Delta variant, in Israel and the UK. That wasn't what was happening if those layers are in place. Masking, ventilation, a lot of people vaccinated around the school, in the school, kids 12 and up, adults. All those pieces are actually very effective layers. So it would be unusual for anything to be shut down. So that's the general answer. The other thing is, the question was, sort of how about all schools? So it'd be like, I don't think we're in a world where we're going to be going back to all schools shut down, given how much we know and how many supports we have in place. It would be very unusual for a school to shut down, but there are schools that sometimes have shut down early in the pandemic if they have a lot of cases and they're just trying to figure out what's going on. They might pause for a little bit just to make sure that nothing is getting spread. But it's like I said, when those layers are in place, generally speaking, they're just super effective.
I think, Kimberly, I would add, as a board member, I can tell you what I'll be looking for. And this is going to be from one school district to another school district, right? And so I think the idea is now, I'm sure Dr. Webster can talk more about it, is really about, we know what we're looking for now. We've seen this stuff in action now for over a year, right? And we know that there could be a likelihood that a young person can get it while they're in the community and then come in, right? Or whether it's something where a young person is now, that young people are spreading it amongst the campus, right? We have more senses about what these things would look like. And so, I mean, I agree. I don't think there's going to be any more times where whole districts shut down. It's going to be a school by school basis. But then also making sure that we understand, which is why contact tracing is going to be so important to see, right? Did this case come from outside in the community, or is this a case where we're starting to see a spread within a school in and of itself? And so we just got to take a very close look at it, make sure that we take it seriously, but also, like I said, making sure that that schools and districts now have a whole host of resources and professionals to call in when necessary to get a second, third, fourth opinion on some of these things.
Thank you. Why aren't schools practicing 6 feet apart?
I could let Dr. Bardock or Barbara Cole answer that, but I'll go ahead and get started. If they want to piggyback on anything I say, that's fine. Well, we know that kids don't transmit the virus as well as adults, so they don't need to be as far apart. And they did a study where they were 3 feet apart and they didn't transmit it as much. So that's one reason why. And I'll let you go ahead, and if you want to weigh in on that, you can.
Just from the school perspective, we know that if we all mask up, we don't have to have social distancing. And from a logistics perspective, school districts would struggle with transportation on buses to social distance, as well as providing instruction to full classrooms if we social distance. And so if we social distance, schools will have to do some type of a hybrid where they'd only have to be able to serve a portion of their schools, their kids at a time. And so the guidance that we've received from the California Department of Public Health is that we don't have to social distance because of the requirement to mask up.
Thank you. Will teachers and staff be required to get vaccinated?
Go ahead, Dr. Burdick. I was just going to say that we've not received that requirement from the state as yet.
Mm-hmm. Yeah. And it's an emergency use authorization vaccine right now. So it's gone through a lot of close review at the FDA, but in order to get a full FDA approval, it's still undergoing a full FDA approval. And so anything that's an emergency use authorization can't be required, generally speaking. So it's not required in any of these situations right now.
Thank you.
Yeah.
I think we kind of touched on this, but I'm not sure if it was exactly answered. Forgive me if it was. If a child or a child's home gets sick, will they have to quarantine for 2 weeks?
Maybe I'll start out with that, and then Dr. Mitchell, you can also comment. just to clarify, the question I think is if a child has symptoms of a virus, a runny nose, etc., then that's the recommendation to do the testing to see do they have COVID or do they not have COVID. And that's just because COVID actually, particularly in kids, very mild symptoms often, and it kind of looks like a regular cough and a cold. So it could just be a regular cough and a cold, or it could be COVID, and the test really helps to figure out that difference. If a kid is sick with COVID, then they stay home, and anybody else who is exposed to them at home also stays home. So the kid is what's called a case, and they're isolating, meaning they're staying at home so that they don't get other people sick. And the person who's quarantining, who's also staying at home because they live with that other person, they're staying at home just in case they get COVID because they might have caught it from that other person. So they stay home and do what's called quarantining. But if nobody in the home has COVID and they just have a runny nose, then just that person with a runny nose should go get the test. Hopefully that clarified things. But Dr. Mitchell, I don't know if you want to.
Yeah, I was going to say the exact same thing. I think that getting the test keeps us from having to just quarantine. I think what we were doing initially was being super safe. And hey, a kid come in with a runny nose, we send the whole class home. And I think that's imprudent at this time. I think that getting some real information about COVID status is the most important thing to do to minimize quarantining hundreds of kids, because this kid walked down the hallway and then they were in PE with other kids, and they were, in middle school, high school, they'd be in 6 classrooms. So potentially one kid with a runny nose could have us in an alarm state and sending home 150 kids. So I think testing is the key.
This is Barbara with Public Health. I just wanted to add, I also heard in that question, what if the student, someone in the home is ill? So let's say it's a parent that tests positive. So then we get a question, should that child be in school? So if they're being exposed to a positive person in their home, they do have the risk of becoming infected. So again, testing will give you an answer, but it's important also not to test too soon, because if you test too soon, it doesn't show up. So normally when we are looking at who has it, the child, until we know their status, the safest approach would be for the child not to be in school. Again, using the scenario that it's the parent or even a sibling in that home that is positive. So unless the positive person can be isolated away from the rest of the family, every day that they're infectious is a potential risk to that individual becoming infected. Now, let's say, however, the child in school is positive, then we get a question about other children, and we call it a contact to a contact is not a risk. The person actually has to have been exposed themselves and potentially be incubating in order to present a risk in any setting, but particularly in a school setting. So very important, and that's part of what the school team does, is really look at who has the disease, who's been exposed, what's the risk to others. And so, sometimes it's an older sibling that's been in the classroom without a case, and the concern is, can they be there? Unless they've been exposed themselves, they would not be presenting a risk. So that's an important distinction. We try and help parents and school officials appreciate who really is at risk in terms of spreading disease. But I agree, key is testing, as long as you don't test too soon, and knowing the status.
Thank you. If a student tests positive, how soon will parents be notified? If a student tests positive in a parent's classroom, how soon will that parent be notified that there's a positive student in the classroom?
Yeah, so we would be sending home letters to parents that same day.
Same day. Perfect. I just want to read a comment. I think it's important to read comments as well. Placing the responsibility on the parent to keep their child home seems crazy because most people don't think it's COVID right away, although we have been going through this for almost 2 years. Especially with parents going back to work, they are not going to be fully as mindful and dutiful to check with their child daily. I think that's a valid concern. I don't know if anybody has a comment to that, or I just want to make sure that I'm reading some of these, what parents are feeling. Go
Maybe I'll make a comment. I see Carmen, you're off mute, but so maybe you want to make one also. But I just you know, throughout the pandemic, we get really involved in our fighting against each other, and we forget sometimes that we're fighting against the virus. So I keep on encouraging people, we are in it together. The more we look out for each other, and as much as we can keep our kids home when they're sick and get those testing, and we stay home when we're sick and get tested, and you got to focus on the taking care of each other piece of it. It's really hard sometimes, but I keep on encouraging people to do it. That's how we're going to get through it. You know, we're fighting against the virus, and if we keep on thinking that the virus is the enemy, then we do a better job of taking care of each other. So, and then it's a question of remembering how to do it. So that's the school is helping to remind parents, you know, stay home when sick, but a lot of it is remembering that we're taking care of each other. So thank you for the comment. Thank you for reading out loud.
Yeah, I agree with that totally. And I think we also have to empower our children to notify the school nurse or notify someone when they're not feeling well, or tell mom and dad when they don't feel well. That's part of giving them a voice as well.
Thank you. I definitely want to read this comment. This is for you, Corey. I appreciate what Corey said. The parents need to support the schools and stop fighting us. Teachers aren't the enemy, and we want what's best for kids, and we want them to be in person for learning. And so get vaccinated. But I just wanted to share that with you, Corey. Your words were very impactful, so thank you. There are a couple of questions about, and we're at 7:20, so we roughly have about maybe 7 more minutes for a couple more questions, but there are a couple of questions about, will this recording be available, how they can rewatch the webinar. It will be available, I believe by the end of the week, on the Safe Schools for All Parents page. Before we end, I will put up a slide with that information, but it'll definitely be available again for you to be able to go back and look at. Let's see, Dr. Clay. Yes, moving into hybrid really demonstrated just how important the peer relationships and teacher relationships were for kids. It was an immediate improvement for them, for so many of them. Dr. Clay, I don't know if you wanted to respond to that or add on to that.
Thank you. I would like to just note that there was a comment in there, and I don't know if it was a parent or not, but the comment was essentially around grief and loss, and how the individual was able to overcome the loss of their grandparent by being able to process it with their peers, just kind of echoing the sentiment that we need each other. And then I also want to just comment that there's a parent who felt that that their role was being minimized as parents. And I just want to echo the sentiments of my panel, my co-panelists. We absolutely don't want to devalue parents. We need you. You are the ally and advocate for your kid. And Corey, I'm gonna speak on behalf of Corey. He wants you to advocate for your kids. He knows your role is essential. And when I was echoing his words, it was definitely not a sentiment of parents aren't important, because you are important. You're the key stakeholder. Next, second to the kid, you're the greatest voice to advocate for on behalf of your kids' needs, especially if we're talking about kids who have needs that are not visible. We need you to be able to say, my child's asthma or anxiety is being agitated by the mask. And talking to your pediatrician is important. We need your voice. We just can't say enough about how important your role is. But sometimes we do, as parents, prevent the process from happening. The process needs to happen. We've got to get back in school. How it happens, what it looks like for your child, that should be, definitely discussed as a family. We're not trying to enforce something on you. We're not injecting you with the vaccine or even suggesting that it's best for your family or your situation. We're just saying that it's time for us to move forward, and here's some healthy ways that we can do it together. So I'm hoping that helps. Just speak to the comment that was in the chat.
Thank you, Dr. Clay. I think what's important to know is whether we like it or not, we have to act like a community again. Individualism is going to kill us all. The idea is that if we're going to act like a community again, that means it's not just based upon my opinion and what I want, it's what's best for the common good. And the overwhelming data suggests all over the world right? That we all have to wear our masks, and we are putting kids in danger if one of us begins to try to get a whole district or a whole school not to require masks, right? We have to understand that, okay? And so if we're going to say we really are part of a community and we want to be helpful contributors of a community, we have got to say, it may be an inconvenience to me. There might be something in the back of my head that says there's something wrong with this, something shady going on, right? But at the end of the day, we know that masks are better than not. Vaccinations are better than not. Then why not make sure that we set up our young people for success, right? And once again, parents are essential, right? But also it takes a whole community to make sure that a child is set up for success for their future, right? And so just think about that. When I don't feel good about something, when I don't necessarily agree with something, I need to think about, okay, that's my personal opinion, but what stance should I be taking that's best for the community as a whole?
Thank you, Corey. Here's a good one. How close are we to having a COVID-19 vaccine for children under 12 and as young as 5? I'm concerned that my 5-year-old may be exposed to COVID at school. She's a part of the Desert Sands district. Given that educators are not mandated to be vaccinated and some parents won't vaccinate their children.
I'll answer the vaccine question. It's and I just acknowledge the rest of the comment also. So the vaccine is being tested in kids younger than 12. So the 5 to 11-year-olds right now, they're in what's called the clinical trial, which is where they are giving it to younger kids, using some information that they had about in a smaller group of kids about how to do it safely. They sort of did a little dose test to figure out, do they need to do a smaller dose than the adults? So they did that, and now they're doing a larger group of kids to see, is it effective? Is it able to prevent infections, prevent hospitalizations in that younger group as well? That trial is ongoing. The information is probably going to be available. The data from that trial, the kind of answers from that trial is going to be available probably in September is what they're saying. It might be a little bit longer because they're trying to decide how long they should be monitoring the students or the children. They're actually doing it longer than they did for the adults because they're taking, of course, taking it very seriously in the kids. They also did it seriously in the adults, but because the kids are younger, they're watching them for a slightly longer time. And once that information is available, then the FDA, the Food and Drug Administration, which is the national body that looks at vaccines, is going to review that data. And if they approve it for what's called emergency use authorization, then the students can get it. The 5 to 11-year-olds can get it. There's also a trial for the younger kids that is also underway, but it's not as far along as the 5 to 11-year-olds. So they're thinking 5 to 11-year-olds probably get that information by or approval probably by October, November, something like that. And then the younger kids will be a little bit after that, also within a month or two after that would be. And it's just, and the only caveat to that is that we're learning, they're doing the trial. So all of the sort of pieces need to fall into place. But in general, the vaccine has been looking like it's going to be effective in the younger age groups as well. And sorry, effective and safe in the younger age groups.
Thank you. We have time for one more question. I think it's a good question. They're all good questions, but this one talks about how will it work when children are in the cafeteria and they have to take their mask off to eat?
Well, I can just share what we've been told. When children are eating, they're encouraging the schools to provide as much distance as possible. So we know that they have to take off their masks when they eat and drink. So they're encouraging the schools to maybe distance the tables and in the cafeteria, or maybe have shifts where the kids come in to eat by groups at a time. and to provide as much distance as possible. And as Dr. Wardock said, I open the windows, let the air in. That also helps.
Perfect. Well, I want to thank our panel. We are at 7:28, and I want to be respectful of our attendees' time. Before I end and put up the slide with the information of where you can go to find out more information, I want to give the floor to Dr. Bardock to provide some closing thoughts. Again, thank you to all of our panelists. I appreciate the fact that everyone had something to add that was relevant. I appreciate the comments that supported some of the comments that you heard from our panelists. And so again, thank you very much for participating tonight and being so kind with your time.
Thank you so much. And thank you for your fantastic moderation, Kimberly. It's really great. You know, there's so many questions and it's really helpful that you help us get all the information out and phrase them for folks. So I just want to end, of course, by saying a big thank you to all of our panelists. Really, really appreciate it. And then I like to also give, as a pediatrician, I always find it's really helpful to be able to give parents something to do, tools, something so you feel like you know what something you can do on behalf of your children. You've heard a lot of those themes today already, but just encouraging you, empowering parents to be able to ask questions. Hopefully this information is helpful to you to understand better what those safety layers look like and how you can have those conversations with schools, with teachers, with other parents. And then also tools you can use with your kids, which is another theme that we've had tonight, which is helping them prepare for school. Just remind them you're going to be having masks. It's going to be a little bit different than it's been before. We are going to be full school, helping them talk about how they feel about that. There's going to be a range of different emotions, and just allowing that emotion to be and listen to it and hold it, and then help them imagine what it's going to look like to be back to school, particularly for the younger ones, can just be really, really helpful. So they can wear their masks. They can, remember that they're going to be washing their hands, and just helping them understand the information that might be coming at them and giving them straightforward information just in case they're hearing other things that may or may not be right, making sure they get good information that makes them feel like they understand and they're also empowered. So thank you guys, everybody. Really appreciate it. We are all in this together. We will get through it together. And we really appreciate your time tonight.
Thank you, everyone.
Thank you, Dr. Bardock. I want to quickly share this last screen. Again, for more information, for resources, for updates, please visit the Safe Schools for All page. There is a parents page that has specific information for parents. This is the URL. We encourage you all to check in frequently. The recordings for this panel as well as other panels will be uploaded to the site later this week. There's also a number for those without internet or digital know-how. It's 1-833-422-4255. Take a screenshot if you're able to. If not, just remember Safe Schools for All. Just Google that and it'll take you directly to the website. With that said, we want to thank you all for your time, and we hope that you found the information useful. Wishing everyone a good night. Thank you.
Good night. Thank you.
Thank you. Good night.
Thank you.
Good night. Thank you.